Stop diabetes. Do you have diabetes during pregnancy? So watch the video to the end. The main cause of diabetes varies according to the types of the disease. But it doesn't matter what type of diabetes you have. In any case, the disease can lead to excess sugar in the blood. High amounts of sugar in the blood can lead to serious health problems. Chronic diabetes includes type 1 diabetes and type 2 diabetes. Prediabetes and gestational diabetes are among the potential factors leading to diabetes. Prediabetes occur when blood sugar levels are higher than normal, but not high enough to put that person close to developing diabetes. Prediabetes are often a precursor to diabetes unless appropriate measures are taken to prevent its progression. Gestational diabetes occurs during pregnancy but may be resolved after childbirth. Symptoms of diabetes. Symptoms of diabetes vary depending on blood sugar levels. Some people, especially those with prediabetes or type 2 diabetes, may not experience symptoms at some point. In type 1 diabetes, symptoms quickly appear and become more severe. Type 1 diabetes. Type 1 diabetes is an autoimmune disease. The immune system attacks and destroys pancreatic cells, where insulin is made. The cause of the attack has not yet been determined. About 10% of diabetics have this type of diabetes. Type 2 diabetes. Type 2 diabetes occurs when the body becomes resistant to insulin and glucose accumulates in the blood. Causes of type 1 diabetes. The exact cause of type 1 diabetes is unknown. What is clear about this is that the immune system, which normally fights harmful bacteria or viruses, attacks and destroys insulin-producing cells in the pancreas. This does not produce low insulin levels or insulin at all. Sugar accumulates in the bloodstream instead of being transferred to the body's cells. Genes may be the cause of diabetes in some people. It may also cause some kind of virus to enter the body and cause an attack on the immune system. Type 1 diabetes is thought to be caused by a combination of genetic susceptibility and environmental factors, although exactly these factors remain unclear. Weight gain is not believed to be a factor for type 1 diabetes. Reasons for prediabetes and type 2 diabetes. In prediabetes that can lead to type 2 diabetes and in type 2 diabetes, the body's cells become resistant to insulin function. So the pancreas is unable to produce enough insulin to overcome this resistance. Instead of the sugar produced in the cells stored and used, it enters the body's bloodstream. The definitive reason for type 2 diabetes. Why this happens is unclear, although genetic and environmental factors are also believed to play a role in the developing of type 2 diabetes. Overweight is strongly associated with type 2 diabetes, but not all people with type 2 are overweight. In addition to general symptoms of diabetes, men with diabetes may have low libido, erectile dysfunction and muscle strength. Women with diabetes can also experience symptoms such as urinary tract infections, yeast infections and dry skin. Type 1 diabetes can develop at any age, although it often appears in childhood or adolescence. Type 2 diabetes, its most common type, is possible at any age, but it is more common in people over 40 years of age. The cause of the prevalence of type 1 diabetes. Family history. Environmental factors, exposure to viral disease. The presence of immune system damaging cells. Geographical conditions. Type 1 diabetes is higher in Finland and Sweden. The cause of prediabetes and type 2 diabetes. Overweight. Physical inactivity. Family history. Race. Aging. Pregnancy. If the baby is born above 4 kilograms, the risk is higher. Polycystic ovary syndrome. High blood pressure. Abnormal levels of cholesterol and triglycerides. High stress. Insufficient sleep. Smoking. Alcohol consumption. Long-term complications of diabetes. Long-term complications of diabetes gradually develop. The longer you have diabetes and the lower your blood sugar levels are controlled, the higher the risk of complications. Ultimately, complications of diabetes may be debilitating or even life-threatening. Possible complications include cardiovascular disease, nerve damage, hearing impairment, Alzheimer's, depression, kidney damage, damage to the eye, heart attack and stroke. Symptoms of type 1 and type 2 diabetes. Some of the signs and symptoms of type 1 diabetes and type 2 diabetes include increased thirst, frequent urination, extreme hunger, unprovoked weight loss, ketone in the urine, fatigue, irritability, blurred vision, gradual appearance of scarring, recurrent infections such as gums or skin infections and vaginal infections, biting of fingers and hands, stop bleeding, insufficient concentration. Diabetes cannot be eradicated from the body, but by controlling blood sugar properly, it is possible to prevent or minimize the damage caused by it. The optimum limit for fasting blood sugar is usually between 90 and 130 milligrams per deciliter. Of course, this amount varies based on the age and condition of the patient in different people, but it should be noted that being asymptomatic does not mean optimal control of blood sugar. The optimum level of blood sugar 2 hours after meals is less than 180 milligrams per deciliter. Blood tests for diabetes diagnosis. Anyone with diabetes symptoms or at risk of developing the disease should be tested. Women are routinely tested for gestational diabetes in their second or third trimester of pregnancy. Doctors use these blood tests to diagnose prediabetes and diabetes. Fasting plasma glucose test will measure your blood sugar after 8 hours of eating. The test, A1C, provides an image of blood sugar levels in the past 3 months. To diagnose gestational diabetes, a doctor tests blood sugar levels between 24 and 28 weeks of gestation. Measurement of fasting blood sugar. Diagnosis of diabetes is very easy and by taking a small amount of blood after at least 8 hours fasting and measuring its glucose. It should be noted that water consumption is permitted during fasting. If your blood sugar is less than 100 milligrams per deciliter in fasting condition, your test results are normal and you should not worry. But if your blood sugar is between 100 and 126 milligrams per deciliter, you are at risk of developing diabetes in the future. Fasting blood sugar of more than 126 milligrams per deciliter, on at least 2 occasions, is a sign of diabetes. Increased blood glucose is the most important physiological factor regulating insulin secretion. The concentration of blood glucose in the high state is between 80 and 100 milligrams, and this threshold is the concentration from which aggression stimulates insulin secretion. The greatest stimulant effect of glucose is achieved when its concentration in the blood reaches about 300 to 500 mg/cent. The effect of lifestyle on the treatment of diabetes. Type 1 diabetes cannot be prevented. However, there are healthy lifestyle cases that help treat prediabetes, type 2 diabetes and gestational diabetes. Lifestyle changes can help prevent the disease. Eat healthy foods. Choose more low-fat, caloric and fiber foods. Work to avoid boredom to create diversity in your daily life. Most diabetes prevention strategies include simple changes to your diet and fitness. Ways to prevent type 2 diabetes. Here are a few things you can do to prevent type 2 diabetes. Have at least 150 minutes a week of aerobic exercise, such as walking or cycling. Remove saturated and trans fats from your diet along with refined carbohydrates. Eat more fruit, vegetables and whole grains and reach your ideal weight. What foods cause high blood sugar and diabetes? Starches. Clean cereals such as white rice, white flour and white bread, fries. Vegetables. Canned vegetables with plenty of salt additive, cooked vegetables with plenty of butter, cheese and sauce. Pickled and salty, if we have salt restrictions. Fruits. Compotes or other canned fruits with sugar, pastilles, dried fruits, jams and jelly, a variety of juices. Proteins. Fried meat, oily parts of meat such as ribs and rubble, sausages, salami and bacon, high-fat cheese, a variety of bird's meat with skin, fried fish. Dairy. High-fat milk, high-fat yogurt, cream, high-fat cheese, high-fat ice cream. Fat and confectionery. Any food that contains trans fat, we need to check the label on food in this respect, is a large volume of saturated fat, which is basically taken from animal products. If we have heart problems with diabetes, we need to consult with our doctor about this. Drinks. Carbonated beverages. Fresh juices or combined drinks of juices, sweet tea, coffee with sugar and sufficient energy drinks. Type 1 diabetes. If you have this type of diabetes, you should inject insulin every day, because your pancreas no longer makes insulin. Type 2 diabetes. If you have this type of diabetes, your treatments can include medications, insulin and lifestyle changes, such as weight loss, healthy food choices and more physical activity. Prediabetes. If you have this disease, the goal is to prevent it from turning into diabetes. Treatments focus on risk factors, like losing weight by eating a healthy diet, such as the Mediterranean diet, and exercising at least 5 days a week for 30 minutes. Many of the strategies used to prevent diabetes are the same strategies recommended for the treatment of diabetes. Gestational diabetes. If you have this type of diabetes and your glucose levels are not too high, the initial treatment may be to refine your diet and exercise regularly. If the target is not achieved or your glucose levels are too high, your doctor may prescribe medication or insulin. Symptoms of hypoglycemia include feelings of hunger, body tremors, sweating, palpitations and anger. If necessary measures are not taken to deal with hypoglycemia, the following symptoms will include headache, visual impairment, abnormal behaviors and movements, and eventually seizures and anesthesia. Useful measures when blood sugar is lowered. If the patient is not unconscious, a glass of mixed water and honey is effective. If the patient is unconscious, call the emergency room. Don't ignore doctor's visits. If you see possible signs of diabetes, contact your doctor. The earlier the disease is diagnosed, the earlier the treatment begins. If diabetes has already been diagnosed, you will need careful medical follow-up until blood sugar levels are stabilized. Pay attention to the table below. Main symptoms of diabetes. Golden tips. Fruit consumption instead of juice. Consumption of raisins, dates, honey and figs instead of biscuits and sweets. No consumption of soda drink. Daily exercise. No alcohol consumption.